Great, great, great. Okay, it's 1 o'clock. I think we're ready to go. So hello, everybody. My name is Mary Jane Burke, the Marin County Superintendent of Schools, and I'm very happy to have our Public Health Officer, Dr. Matthew Willis, with us, as well as the Deputy Public Health Officer, Lisa Santora. We look forward to providing you some up-to-date information as we look forward to opening our schools. But let me, at this point, ask Araceli Nunez to provide information to our colleagues who are listening in Spanish. Thank you, Araceli.
Buenas tardes. Esta actualización de salud pública para la comunidad escolar se está grabando y estará disponible en nuestro sitio web MCOE Rethinking Schools dentro de las 24 horas. Este webinar también se transmite simultáneamente en español. Si desea seguir escuchando en español, haga clic en el botón de interpretación del idioma que parece un globo terráqueo. Gracias a Marta Vitón, que es nuestra intérprete hoy. Finalmente, gracias por enviar sus preguntas con anticipación. Haremos todo lo posible para abordar la mayor cantidad posible. También puede hacer preguntas en el chat y intentaremos que se las responda. Se combinarán todas las preguntas que surjan y que sean de naturaleza similar. Gracias.
Great, thank you so much, Araceli, and in advance, thank you, Marta. We're very excited to begin the 2021 school year. We've been having several different opportunities for members of the public and all of our partners to have direct conversations with Dr. Santora and Dr. Willis. And want you to know that this meeting that's scheduled today is being recorded. It will be available on the Rethinking Schools website by this evening. We say 24 hours, but it's usually sooner than that. And that we have scheduled monthly meetings to continue to provide information to the public. The next meeting is scheduled for September 14th at 1 o'clock. So you can look forward to the next opportunity. And the only thing I would want to let you know now is that I had a chance to speak with the 16th District PTA President, Jen Moore, and we have set a session for parents, specifically for the 25th of August at 6:30. So we'll get the information out about that right away. And at this point, I'd like to turn this over to Dr. Willis. Thank you.
Thank you, Mary Jane. Good afternoon, everyone. It's great to be with you. I think this is probably the most important conversation we could be having from a public health standpoint right now. Reopening schools is an important priority for us, not just for public health, but for health of the community as a whole. And doing so safely has been a priority for us really since we first closed schools, among the first counties to close our schools back in March 2020, when we were seeing surges in cases of the novel coronavirus or SARS-CoV-2. Didn't even have a name yet at that point. And it has been one of the, I think, critical elements of our success, of our response to the pandemic, really over the past year plus. I'm feeling optimistic and confident as we come into this school year, but also cautious. And we'll talk about some of the reasons why we have optimism and confidence, but also some of the reasons why we're exercising an extreme level of caution as we proceed. I'll offer some just general context, some of the numbers now, and then hand it over to Dr. Santora, who will go through the elements of our school site specific plans and address other issues. Next slide, please. So there you go. We know how to do this. Thanks for that vote of confidence there on that slide, Mary Jane. So this is health defined. This is how we've been approaching our pandemic response right from the start in Marin County. And that's really looking back to the World Health Organization Constitution of 1948, which still stands and is probably even more relevant to us now, which is a state of complete, health is defined as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And I think this is a really critical lens for us to apply to the school environment. We've learned a lot over the past year that school closures, when they occur, do come at significant mental and social cost, and that needs to be balanced against the mitigation measures to prevent infection itself. And I'm going to talk a little bit more about the increasingly important designation between infection and disease as we look at case rates for COVID-19, especially in the Delta era. Next slide, please. So this is just our status, over the course of this pandemic, daily cases since the beginning. Seeing our four waves, clear surges there, starting in the first in March 2020. Now we're seeing that surge. It started really in July, the most dramatic increase in cases actually of any of the surges, despite high vaccination rates, really attributable to that more contagious Delta variant. And now we're seeing signs that there may be a little bit of a plateauing in terms of our case rates, really too early to tell. But we're now, just over the past few days, we've seen start rising cases again. So some signs that we may be, if we're feeling optimistic, starting to see a plateau, although the case rates are still high and transmission rates within the community are high, but that rapid rise has seemed to have slowed. Next slide, please. And this is our hospitalization rates, currently 16 in the hospital, 4 in the ICU in Marin County. Next slide, please. These are our vaccination rates. We have been really singularly focused as our primary strategy, recognizing the benefit of vaccination to get as many Marin County vaccinated residents who are eligible to be vaccinated. We're at 95% of those who are eligible above age 12, vaccinated with at least one dose, almost 88% with 2 doses fully covered. Next slide, please. And that places us as the most highly vaccinated county in the state of California, 58 counties, a designation that we've held really since they started offering these comparative analytics, and among the most highly vaccinated counties in the United States. Next slide, please. Importantly, in terms of those vaccination rates by county, the other factor is that all of the other counties, the top 8 counties in terms of vaccination rates are all Bay Area counties. And the top 6 are those same 6 counties that came together in early March of last year to have that common shelter-in-place policy. So we're fortunate to be embedded within a region where there's been a strong public health response. Important piece of context on those numbers is that, and we'll talk a little bit more about this, is that vaccinations has allowed us to, there's no longer as strong a link between case rates and hospitalizations because of the protection of vaccine. Last time we had this number of cases, and this is looking at August 11th, the patterns still hold. The case rates on August 11th corresponded to case rates of January 29th in terms of raw cases, but on January 29th, we actually had 29 people in the hospital. And on August 11th, we had 10. So as our case rates rise, our hospitalization rates are not rising at the same rate as they had back in the pre-vaccine era. And that's again because of the protection the vaccine offers. Next slide, please. So I want to get into this concept of disease versus infection. And I think this is going to be important for us to all carry with us forward. As we see and anticipate to see more cases associated with a more infectious Delta variant, we need to recognize that between vaccination and then those who are more vulnerable to being infected, that is our children who are unvaccinated, there's an important mitigating factor in terms of what that means. What is the threat that infection carries? So people who are vaccinated, compared to unvaccinated residents are 5 times more likely to be infected with COVID-19 in Marin County. These are based on our numbers. So the case rate among unvaccinated residents is about 40 per 100,000 and about 5 times lower for vaccinated residents. Compared to people who are unvaccinated, unvaccinated residents are 50 times more likely to be hospitalized in Marin County. So right now, I think over the past, since March, we've had about 56 people in Marin County hospitalized with COVID-19. 49 of them were unvaccinated. And if you look at that as a rate across the population, we have so many more people who are vaccinated than who are unvaccinated, that rate is actually 50 times higher risk for being hospitalized if you're unvaccinated. 186 out of our 187 deaths have been among people who were unvaccinated. You may be aware that we had our first death of a vaccinated resident last week. And we are seeing more breakthrough cases are occurring with the Delta Delta surge. That's because Delta variant is probably 4 to 5 times more infectious. That R naught, the reproductive number that relates to its infectivity, is about 4 to 5 times higher than it is for the non-Delta variant, the original strain. So we will expect to see more infections, even among vaccinated people, but the symptoms are milder, the level of infection is lower, and the risk of infectivity to others is also lower if you're vaccinated. Next slide, please. And I just want to remind us that some of those principles also hold true for children, especially even unvaccinated children. We know that children 0 to 11 are not able to be vaccinated yet. That's likely to come online. We're hearing October, eager to hear the announcement from when the FDA actually authorizes that authorization for them. We are working with our schools, with our healthcare providers, pediatricians, and public health to be ready to roll as soon as that happens so that we can have the same success with our little ones that we had with our 12 and above. And hopefully that will happen in October. But just reminding us, our residents age 0 to 18 make up 20% of our population, about the same percent of our COVID-19 cases, but just under 1% of our hospitalizations and none of our deaths. The youngest resident, I think, who has passed in Marin County was 38 years old. Next slide, please. This is I think this is really what tells the story from an epidemiologic standpoint, and why we are approaching the school year with even more caution, despite the success of last year, is that there is a new variant that is really dominant now. These columns represent cases by week and the variants that we're seeing, and it's about 95% Delta over the past month. What this also shows is the threat of other variants that may emerge. We saw a couple of the Gamma variant. We had all Delta the week before. Now we saw a couple of Gamma variant, and there's other variants that have different characteristics that, because of the global nature of this pandemic and the likely emergence of new variants, especially given the lack of success in the developing world and really getting vaccines effectively to everyone. None of us are safe until all of us are safe. And a global perspective. And so we need to be prepared for and adaptive, as we have been, to the potential emergence of other variants that have different properties. Next slide, please. And this is just another, I thought, a really interesting graphic way of depicting that dominance over time of the Delta variant. You see on the left there, early July, that dark blue represents the proportion of samples that were the Delta variant across the state of California. Maybe 40% of the total. And now it's just over time, more and more. And now it's pretty much the dominant strain throughout the state of California, which explains why we're seeing rapid increases in cases still, especially in areas that have lower vaccination rates than we're in. Next slide, please. So looking back at school data, this does tell the story of what sort of a harbinger of what the Delta might represent for us. This shows by month what status we were in. Remember, going back to that blueprint for a safer economy when it was all based on tiers. We're no longer using that tier status. If we were, we would be in purple. But we are, we recognize that we started reopening schools when we were in the red tier, and then we went into purple. Then in August of last year, we were actually in the purple tier, started reopening schools, allowing waivers. We were not seeing in-school transmission, and that was because of the effectiveness of our strategies. We were watching very carefully. These are the numbers that were posted on our website, on the dashboard that will be put back up. We'll be tracking this very carefully. But the point here is that we had gotten down to yellow level, right, which was less than 2 cases per 100,000 residents at the community level in June of 2021, just before the end of the school year. And did see an outbreak, which is actually going to be published by the CDC in their weekly main publication next week, based on the data analysis we did this particular outbreak at one school in Marin, where an unvaccinated and only partially masked adult, we actually saw transmission rates of about half the students in the classroom were infected, and we were able to do clonal analysis to determine they were the same clone that was actually related to that same outbreak, that same individual, and it was all Delta. So it really was a sign to us that the Delta is a game changer in terms of the risk for transmission. 33% of our cases of all cases that we had in school transmission over the entire year were attributed to one classroom in one setting, and it was really the first time we could see the Delta variant. So that's why, if anyone's wondering why we're taking special precautions this year, including recommending facial covering outdoors, it's because we have a lived experience, if you will, in Marin County of what the Delta variant can bring and the risk that it represents. And we're seeing other areas across the nation that are opening where Delta variant is also dominant, where they're seeing more cases. In fact, some are having to close classrooms or schools, in fact, because they were not prepared for that eventuality. We don't want to make that mistake. We are prepared. And Dr. Santor is going to go over some of the specific elements of that preparation now. Thank you.
Thank you, Dr. Willis. I just wanted to add with that particular exposure, there are other factors that we could have controlled. There was an unvaccinated staff who reported to work with symptoms, and there was reports of inconsistent adherence to masks. So, which is why we really just need, and we'll discuss as we move forward our recommendations, to double down on the basics that we have been following in public health prevention, which is vaccinating, number one, vaccinating all eligible persons. Vaccinations, as Dr. Willis described, protects our community and cocoons our unvaccinated, ineligible pediatric population. Not to report to work when sick during COVID times, to stay at home and to get tested. At this point with the Delta variant, we are seeing different symptoms. So if you have a new symptom, you should get tested and not assume that it's allergies. So that's number two. And then three, just the critical importance of wearing masks. Masks off, we'll talk about that a little bit later, but we could have potentially not had as high numbers that we saw at the end of the year if those three ABCs, as you'll be seeing from us, as those three kind of core measures or mitigation strategies were in play. So we can jump ahead to the next slide. So we have been doing this we always say on March 16th, we started gathering together to develop guidance and plan for the reopening of schools. And we were first in state to issue guidance. And then we saw the state follow our practices to provide more information and more technical assistance to schools to support the reopening. But I'm very proud that we started right from day zero to start planning the reopening of schools. We have always known that COVID-19 was going to evolve. That's the nature of viruses. Viruses have lived for thousands of years on our planet because they mutate and figure out how they can evade our immune system. And we're just really fortunate to have technologies and science and medicine to guide us in the development of vaccines to protect us and really prevent hospitalization. But we are always prepared for change because that's what viruses do. I think it's just really important for you to know that we are ready to course correct. We learn every day. As Dr. Willis said, we learned that Delta does behave differently. And we're following international research, national research, CDC guidance, local data, and really to make sure that our guidance is up to date and is designed to optimize that learning experience, as well as protecting staff, students, and the community at large. And we've demonstrated success. We are taking a more conservative approach with the reopening of schools this year because of the Delta variant. We had anticipated probably more relaxations at the end of the school year when we saw cases much lower. And this is the guidance that we offer today has been presented and shared. And we, again, will be ready to update our guidance if we see that it's too restrictive or if it's too relaxed. Jump ahead. So I think I covered all of the points. We have a new framework called our Mitigation Strategies Continuum that we're going to show to you, and we're going to be entering at level C. There's 4 levels of mitigation, and that includes wearing masks both indoors and outdoors, and we'll talk about that a little bit later. But we're hoping, as we are hopefully seeing the end of this 4th wave, that we can also look at the vaccination rates in different schools and see if we can be more relaxed when we have higher percentages of students and staff vaccinated. So again, our goal is to optimize the learning environment and to normalize our school year as much for students as we can while keeping the environment as safe as possible. Jump ahead. So everyone can get vaccinated. It's widely available right now. It's not the shortages that we experienced before. Just go onto our websites and you can check to see where you can get vaccinated, or if you're visiting your local pharmacy, they probably have vaccine on site. And I think the most important thing is if you have been vaccinated and you are aware of family and friends who haven't been vaccinated, to talk to them about why you got vaccinated. One of the hardest parts of Dr. Willis and my day is when we see who's in the hospital. And these are all preventable hospitalizations. And many of the people who are hospitalized experience very poor outcomes and severe illness. And so our primary reason for recommending vaccination is to avoid these hospitalizations. And we know that every person that's hospitalized has a family and friends that surround them. So it always feels disheartening for us when we see these preventable hospitalizations. So, and it's not people listening to us anymore. It's really you talking to your neighbors, families, and friends around why vaccination was important to you. Jump ahead. So we led again the state, but the state caught up to us when we launched with our new 32-point guidance. We're requiring that staff and students provide vaccine verification and recommend. And then we also were considering having testing for asymptomatic unvaccinated staff. And at this point, the state has caught up, and that on August 11th, they issued an order that requires all school workers to submit vaccine verification and to engage in weekly testing if they remain unvaccinated during the school year. We are also going to have vaccine verification status for students. Again, we will be protecting the privacy. We have strong privacy controls in place, but again, it's for us in public health, one, to have that first tool, knowing the vaccine status, if there is a positive case, informs our decisions around quarantine. And so that will help us again, have a more rapid response to any positive cases on the campus. And then we also see it as a tool for potential relaxations when we have schools with high levels of vaccinations among staff and students. Jump ahead. So this is just how it's written in our 32-point guidance. Our goal is that the vaccination rates for staff and students be posted to the school websites no later than October 1st. And we are really thankful and proud of the schools that are already jumping in. Many people ask, how can this be done? Our schools already have systems in place for requiring the reporting of health information as it relates to vaccine status, both for students and staff. And so they are building upon existing structures for them to implement this now state health order. The only thing I just want to comment on here is that we are not recommending at this time testing for asymptomatic unvaccinated students. There's insufficient evidence with from past research that the viral loads in asymptomatic students with no known exposures are going to yield positive tests and be a tool in infection prevention in the school setting. We have had schools across this county engage in testing of students last year, which yielded few positives. We've had large districts across the state engage in screening of asymptomatic students. Again, that did not yield positive cases. So that being said, Delta is changing. And so we will follow the research and follow the data to determine if there would be a change in recommendation. But just to be clear, at this time, there is no recommendation for screening asymptomatic unvaccinated students who do not have an exposure to COVID-19. Jump ahead. That being said, everyone should get tested if they have symptoms. So we absolutely are requiring that anyone who is symptomatic with COVID-19 symptoms get tested for COVID-19. And there's testing widely available in our community. There's even home-based test kits that you can purchase online, but there is still also free public health testing. And you can go and visit our website to make sure that you get tested if you develop any symptoms, or the other scenarios when you should get tested after a known exposure or after return from out-of-state travel. So we are expecting there probably should be an uptick in testing right now as a lot of families are returning to the state from out-of-state travel. They should be getting tested on day 5, and hopefully we'll have a negative test. So face masks, we want to talk specifically around face masks. As I mentioned, we're entering the school year at our level C mitigation continuum, and that's with both outdoor and indoor face coverings. The reason why we're recommending this is because it's a simple, safe, and effective tool to reduce COVID-19 transmission. The primary role masks play is in source control. So you and your respiratory droplets stay on this side. So between 50 to 70% of the protection offered by masks are in source control. And they have also seen that by wearing a mask, if someone were to cough on you, that the masks do offer a level of around 20 to 30% of personal protection. We're encouraging schools to provide regular mask breaks as we start the school year. But what this will do is provide us just time to implement our new guidance, and for schools to start. We have a lot of new staff coming on board, a lot of new students coming on board this school year, and wearing masks offers another layer of protection as we enter the school year. Jump ahead. I already alluded to this earlier. So if you have unvaccinated students who have traveled or returning from out of state, they should test at day 5. They can go to school. This is different than in the past. Again, our goal is to reopen schools and to ensure every student has the opportunity to have earn their what's that special award you get if you have no missed school days? I've never received one. Perfect attendance awards. I never received one of those, but every child and student and adolescent should have an opportunity for a perfect attendance award this year. And that's why there is guidance like the modified quarantine that we'll discuss a little bit later. The CDC has also changed its guidance. Even if you're vaccinated, after you return from travel, you should get tested 3 to 5 days after returning from international travel. We would recommend, this is not a CDC guidance, but we would recommend that if you're returning from out-of-state travel, that you also, even if you're vaccinated, that you get tested. When you're on vacation, you often are just more relaxed in some of your personal protective behavior. So that's a good reason to get tested, even if you're vaccinated. Universal masking, like we discussed, there are exemptions. They're very limited, but we will respect all exemptions with wearing a mask. We also recognize that some students in special education have challenges wearing masks, and we absolutely want to support them attending school as staff work with them to increase their consistency with wearing masks. And then this is also a new change with CDC guidance, is that in the past, before the end of July, if you were vaccinated and exposed to COVID-19, they did not recommend that you get tested. They just recommended that you monitor for symptoms. As we saw an increasing percentage of breakthrough cases, so this is Delta cases in a person who is vaccinated, the CDC changed its guidance and recommends that even vaccinated people with a known exposure to COVID-19 get tested 3 to 5 days after their exposure. There you go.
Okay, so this provides you sort of a simplified overview of the way things are operating. We're calling it the ABCs of mitigation. The foundation, as we've been working from for months, is good hand hygiene, get vaccinated, stay home when you're sick. Stay home when you're sick is very, very important. Many people are used to sort of working through it. And if there was ever a time that it is critical that people stay home when they're sick, that's now. As you can see, ABC, A is the hope that someday we'll get that there are no more mitigation strategies required. B includes universal masking indoors and note symptomatic testing, as Lisa noted. C, where Lisa identified that we are right now, is that we're under universal masking indoors and outdoors with symptomatic testing. And then D, if we need to move in that direction, we would be looking at other factors that we have actually utilized before in our 30-point plan. So for example, it may be that a classroom would need to be on the playground, not interacting at the same time with the whole school, but we're not there yet and hope we don't get there. So you can see that we can move in either direction on this form. But ultimately that we are currently at C, and so students and staff will be wearing masks indoors and outdoors and symptomatic testing.
Can I just add something to that, Mary Jane?
Please.
Yes, so one of the messages early on around vaccinations was that it was highly protective against infection. And that was largely true in those studies that were pre-Delta. And And the studies were actually looking at people who are symptomatic. So the level of protection against infection itself was hard to determine, but we know for sure that with the Delta being more contagious, that people who are vaccinated can be infected, although the range of symptoms is really significantly tilted towards the milder end of the spectrum, as I said, with regards to hospitalization especially. So I think one of the things we're seeing is that people who are vaccinated who have mild symptoms are attributing it to other things. And so we want to just be clear that despite the fact that you're vaccinated, you can feel rest assured that you're highly protected against becoming very ill, but you can no longer really rest assured that it's not COVID-19 that's causing those symptoms. So we want to make sure that people who are vaccinated do stay home and treat them as if they may be infected. And we're recommending testing to follow up on Lisa's point. And the other point I want to make about this is that we thought it was important to outline these mitigation strategies for different levels on that continuum so that we're prepared in that eventuality where we would see reports of cases emerging from the school community. And when transmission rates in the community are, 15 right now, or about 15 or 16 per 100,000 per day, that just signifies that there's a certain amount of ambient transmission going on out there. And so, yesterday, I think we saw 70 new cases. You might see 50 the next day. I watched this very carefully. What that means is that there's just a lot of events in our lives, whether it's a faith-based community or a school group or a club or a sports group. So there will be, and we should be just prepared for the likelihood that as we reopen schools, there will be stories of a parent of a child in the school or someone who's connected to the school community where there was a case. And being prepared, sort of anticipating that and being prepared for how to respond is critical for us. And we can build on the fact that we have a much longer track record established in Marin in terms of how to actually structurally respond to those things through the site-specific protection plans, through the liaisons at the schools, through you as parent community and the school community in terms of having some experience there. But this is in order to prevent that, which I think something happening elsewhere where it might be sort of a hasty response where people weren't expecting that, weren't prepared. And the reflex is just to simply shut things down. We don't need to do that. Thanks.
Great, thanks, Dr. Willis.
All right, and just the last comment on outdoor masks before we jump to the guidance itself is that this is evolving. And yes, before the Delta variant was introduced into our world and were mutated, or the virus mutated and introduced the Delta variant, that there was very strong evidence that there was not outdoor transmission. At this point in the past month, there has been 3 case studies. So these are the challenge with research as we're in a pandemic, and is that it's always emerging science and emerging research. But there are now 3 case reports of outdoor transmission of the COVID-19 due to the Delta variant, which includes the Provincetown experience that you may have seen in the news, also includes concerts, and we have seen even locally in the Bay Area, outdoor concerts being connected to transmission. And then lastly, an outdoor wedding in Texas that was connected to as a transmission event. And that is why with the start of the school year, as we're trying to create and optimize these learning environments, adding this one additional layer of protection, because it's all about layering protection of outdoor masks, especially since in the past month, we have seen these case reports of outdoor transmission. So we can jump ahead now. So here we go. We're gonna run through the 32-point plan. The first 5 points are, a lot of this is gonna look the same. We were anticipating again at the end of the school year, as we saw lower case rates, that we're gonna have a 10-point plan and we're gonna get rid of a 30-point plan. And then we recognized that it was best to keep the practices and lessons learned from our 30-point plan, and then either have a mitigation strategy along with the continuum, allowing us to relax as we saw lower case rates in the community and restrict more higher risk activities as we saw higher cases in the community. So the first 5 points really are focused on the basics, is that we expect schools to follow our recommendations and guidance and orders if they come down from either the state or the local health jurisdiction, that they have all the basic health and safety protocols in place. Most importantly, in this first 5 is training. We recognize that there's new staff, new students, and everyone's going to have to learn what is their COVID-19 safety plan. Each school has a safety plan that they've reviewed and updated. They have seen this updated guidance, and so they've been working to implement the updates into their system. And one of our biggest success, and the group I'm most grateful to, is every week a committed team of public health liaisons meet with our school team, our school nurses team, another amazing group of individuals who to learn about our guidance, to learn about contact tracing and case investigation, to understand the dynamics of this disease. And they are charged with ensuring that the healthiest and safest possible environment is in place at the school. And then we still are recommending cleaning. It's not the same levels of disinfection. We've learned a lot. This COVID-19 is not transmitted through fomites, so we're not expecting everything to be disinfected, but we do expect schools to have a daily cleaning practice in place. You can jump to the next 5. All right, probably the stars. If we can make the stars and bolded, we would, but we don't want to trigger anyone with fonts. But everyone should be screening for symptoms. They should suspect COVID-19 if there's any symptom that they have that is new, and especially if it's a sore throat or allergies. That's the most common symptom that we see people ignore. If you have a sore throat or allergies, you should get tested. Anyone that screens positive for any symptoms should not go to school. They're expected to stay in school. If they develop the symptoms while in school, they should go to the health office or nurse's office and will be placed in isolation until they can be picked up. Number 8 is a long one, and this is going to be something that evolves during the school year. Testing is a great tool for protecting our school environment and for infection prevention and control. And so we have testing strategies that are in place. One of our successes in the response to the outbreak Dr. Willis referred to is that we're able to go on campus and have rapid response testing. So that will be one of our tools we have in place. We also are going to be working with school districts to implement home-based testing. So parents in our community will have access to home-based tests so they can complete their own Binax antigen test at home if one of their students develops symptoms. And then also we have another layer of testing because asymptomatic unvaccinated adults will be tested on a regular basis. So these are tools that we did not have when we started school last year. If you remember, we had long waits and testing turnaround times, and now we have access to more testing resources to identify cases early, to detect cases early, to prevent them from entering that school campus, and then to ensure that we can avoid potential outbreaks and exposures.
Can I jump in there real quick, Lisa? Just the testing options, this is an important, there's been some questions in the chat about this. Just to spend a moment on the changing landscape around testing. It's really important that we really do have this resource now where you can get a result within 15 minutes. And they're home-based. So now it's approved to be an over-the-counter testing option, self-administered, really a game changer for us in the school environment. Because one of the challenges is if there's a delay between symptoms, testing, getting the results back, there could be transmission that occurs there. So we really want to move that testing as far upstream as we can, get it into the hands of parents, get it into families, get it into staff so that people can actually use that test in real time in their lives in practical ways. If someone is having symptoms to get a diagnosis, it's super easy to use. The Binax is an example. It's just a little credit card with a swab. It's kind of like a pregnancy test. You swivel it, you stick it in there and you drop a dropper, and then you see the color tap. There's like a line that emerges if it's positive, and if it doesn't emerge, it's negative. So that's an exciting new tool for us. We're working to optimize that tool for the school setting. We have a pilot set up. The state's going to be supplying us with some kits. So that's a stay tuned on that. And it's going to allow us to I think, have more precise and timely diagnosis of cases when they occur. Thanks.
So number 9, we're hoping today to publish our final decision tree handbooks and exposure protocols. A lot had been changing, so we apologize for the delay in posting, but they should be posted today to our website so parents know exactly what they should do and what's the disposition of their children or adolescents or other household members if there's a potential exposure to COVID-19 case. And then the only thing I want to comment on number 8, just because I saw it in the chat, is that the symptom-based testing, it absolutely requires parental permission. So at this point, most schools probably will not be offering symptom-based testing at the start of the school year. As more testing becomes available, we also may be seeing schools that offer symptom-based testing, but absolutely parental permission is required for any testing of students. So we can jump ahead to our first not currently applicable groups. So this is what's not applicable because we are in a level C as opposed to a level D. So with universal masking in place, this allows us to remove the physical distancing requirements. One of the challenges of returning to school was the physical distancing requirements themselves, which decreased the number of students that could be in classrooms. We have seen with the removal of these physical distancing requirements and wearing face masks, we can prevent transmission. That being said, it's critically important for us that seating charts and attendance records are maintained and up to date. So when there is a positive case, and there will be positive cases, probably due to school-based transmission, but just because of the community activity of COVID-19. When we do have positive cases of students identified who have attended school during their infectious period, this will help inform public health recommendations around quarantine and modified quarantine. So at this point, if you remember last year, we had only one classroom was allowed to be with one classroom. There's no mixing. So that is not in place. So classrooms can mix, staff can mix, and but that being said, we need to know the attendance if there is mixing of classrooms. And we know sometimes teachers and staff go from classroom to classroom. And again, that we really are seeking to optimize that learning environment. And I personally saw that in my kids that being with the same group of people all the time and not having opportunities to interact with other groups, both of different ages and other students in other classrooms, was also detrimental. So we're really striving to make sure we optimize that learning environment. The same thing for high schools. This is always a challenge for the secondary schools because most of those classrooms by nature are mixed, where kids go from classroom to classroom. So there is no recommendation for stable groups in the middle and high school. We had a face forward arrangement about desks when we moved, when we started this guidance. At this point, a lot of that learning environment is optimized when teachers are able to set up those kind of 4 desks together, and so that will be allowable. And I mentioned 14 earlier, is that we absolutely see the school year starting where staff can go from one classroom to another classroom, or classrooms can be combined. So again, the focus is on optimizing the social and emotional landscape for students and staff, as well as those learning environments for staff. This next 4 are just, again, when we saw there, let me run through the next 3. The next 3 is, again, when we really created very tight controls and orchestrated the entry and the exit of students, really trying to make sure everyone was 6 feet apart. Those are no longer required. So the regular entry and exit and schedules are all allowed to be in place. We also used to orchestrate how students were leaving their classroom and moving in their hallways. That's no longer required. That being said, for 15 through 17, some schools may have learned better practices around pickup and drop off. And so if it still works for those schools, it's encouraged. And then also schools may still continue to be more restrictive than us. They can't be less restrictive than public health guidance, but they can opt to be more restrictive. So number 8, Dr. Willis and I are currently considering number 18 around gatherings. We're anticipating updating that to include large gatherings should be held outdoors and a potential capacity recommendation for any indoor gathering. So that's just is under consideration right now. Number 19 was designed when we wanted school leadership to see the entire campus as a classroom. When we were really trying to aim, when we started very early opening schools with limited information around COVID. So we were encouraging the use of outdoor space. Being outdoors is always great, but we also, again, we know that for some students, the outdoors is not the best learning environment. So that's no longer applicable, although we absolutely don't discourage anyone from spending time outdoors. What is applicable and what we continue to encourage is optimizing the ventilation in schools. And we're really thankful to the leadership at school levels and all the facilities who really work to get air purifiers and HEPA filters and reviewed the HVAC systems just to make sure they're optimized. That hopefully will bring us greater benefit when we go into wildfire season as well. So the next, number 20 again was addressing the fomites when we thought that it was possibly fomites by touching a surface that you can get COVID-19. So we are allowing kids to share playground equipment. There can be mixing of students on the playground. Again, we don't, and that was, I know at the end of the year is really hard. Kids were tired of being with the same group of 20 to 30 kids. And so we're really looking for kids to re-engage in that social side of their school day by returning back to a more normal experience. Number 21, it was again helping school leadership see the larger use of the school campus so we can have maximized physical distancing. At this point, we are just recommending that they consider the instructional needs of their class and then optimize that learning environment. We still are encouraging meals to be served outdoors as much as possible. When you eat, you spit, and when you talk, you spit also. So being outdoors is great. It's not required. So if people are indoors, what we encourage is that you maximize distancing between kids when they're eating. Sometimes when I go on the campus, I'll see kids just huddled up eating together. We'd recommend that they not be huddled up, that there be some space, and that they use the tables to factory specifications. So if it's a table designed for 5 people, 5 people should sit at the table and not 10. And then also just reducing the amount of time that people are eating. So reducing the time kids are unmasked and eating to as close to less than 15 minutes as possible. We had number 23 because we wanted it to be very almost regimented and structured around hand washing. This is not applicable because we don't encourage hand washing. We absolutely do, but we don't see the need to interrupt and inject hand washing periods into the schedule like we saw when we first entered school last year. We've already talked about face coverings, so we'll just skip from 24. Training, again, one of the biggest things we see and one of the biggest concerns we get from emails from parents is that people don't wear the right mask. It should be a medical grade mask or a 2-ply cloth mask that's well fitted. When you adjust it, you should be adjusting it on the sides and not pulling it up. It should be over your nose and your mouth. So the common things I see is that people just cover their mouth and not their nose, and they're touching in the center. And again, that's not recommended. So work on wearing your mask the right way. 26 and 27 was again the concerns around fomites. So students can share books, they can share toys and sports equipment. We don't need to quarantine library books for 72 hours anymore. We never recommended the plexiglass barriers. There was never evidence to suggest their work, even though there's scientific, there's plausibility that they prevent transmission by using barriers, but it's no longer applicable moving forward. With number 29, this is an important one. We still are recommending that you limit non-essential visitors. Anyone that's coming on the campus, this doesn't include staff. Anyone that does come on the campus, they should be fully vaccinated. So that the staff who are not vaccinated would have to participate in a testing program. We don't recommend that this other group of substitutes, contractors, visitors, or volunteers participate in a testing program. They should be vaccinated if they're going to be working directly with students. Vaccinate, vaccinate, vaccinate. So really encouraging everyone who is eligible to get vaccinated. We'll be posting the percentages of the school and classrooms that are vaccinated online no later than October 1st. We are not sharing individual status and vaccination status so the student status will not be made known to the teacher unless there's a positive case, and we're trying to manage that a potential outbreak. And then on the contrary, parents and families will not be informed of the vaccination status of their teachers or other school staff. Since May, we've been waiting for updated guidance from California Department of Health as it relates to sports and music. That's probably the third most common question in my inbox. We are still waiting for guidance to be issued from the state. At this point, as it relates to music, really, we would recommend people spend time outdoors. Music is a higher risk activity, especially if you have woodwind instruments. And then as schools are preparing, since we don't have guidance around sports yet, we would just recommend that you look at the April guidance that CDPH issued as it relates to sports as you plan for the sports year. And then lastly, all of these points go into the creation of the COVID safety plans. They all should be updated and made available on the website so families and Parents and students can review those COVID safety plans and prepare themselves for starting the school year. Whew. This is you.
Great. So what's next? Today's meeting, which you're attending, thanks to almost 700 people for joining us. Note that these meetings will be scheduled monthly, and you can see the 14th, October 12th, November 9th, and December 7th. So we have those set. Your public health liaisons, as Lisa and Matt both mentioned, have made such a difference in our community and beyond. They meet each week with our public health partners and Lisa Santora. We've had a meeting with labor leaders, and we'll continue to do that monthly as well. I mentioned a few minutes ago that we've scheduled a meeting that will be focused for parents on the 25th of August at 6:30. Just a reminder, update your plan, and our Rethinking Schools website, that is the place to go if there's any information you need, any of the recordings, the current recordings, subsequent recordings, any of the PowerPoints or information that's shared is available to you there as well. In addition, the Rethinking Schools Task Force here at the county office has an email, rapid response at Marin Schools, and that's the group that continues to respond to questions and issues that come up in collaboration with public health. And you can see public health also has a COVID schools team, and that's their email. So I think that's it. So how about this? We have about, I think, 10 minutes or so. Or anyone else who's been monitoring the chat or questions, could you highlight any that you think are, I know they're all important, but that are coming up more than once? And then Dr. Willis, would you answer the question, or Dr. Santora, about the booster shot? What can we anticipate related to vaccination boosters?
Yeah, that's a good what's next. So as of yesterday evening, I think the CDC's announcement that they're expanding eligibility for boosters to individuals who were vaccinated at least 8 months ago. Not clear exactly yet who that will apply to. It may, in the early stages, apply to older residents, or it might apply to everyone who was vaccinated 8 months ago. Because of our priority for reopening schools and the value of the school community, we had prioritized vaccines for our educators among sort of the earlier cohorts that we were in that setting of extreme demand for vaccine, where we were picking groups. So I think the first teachers were vaccinated, if I'm not mistaken, in January, which might make teachers or educators eligible at 8 months later, so into September. So it's possible that as early as next month, we might be able to start offering booster third doses to educators. And our strategy, while we're still making the plans, would basically be to follow 8 months after whenever any individual would have gotten vaccinated, and working with the school community. We had great infrastructure, great support for our Super Saturdays at the Marin Center, Kaiser, Marin Health coming online, volunteers. And I think that would be provisionally, that would be our strategy, is sort of just mirroring that again to get those third doses for people who are eligible. So that's an exciting step, and it's based on some evidence, with the increased effectiveness of the Delta variant, and then maybe over time, a slight diminution of the effectiveness of the vaccine with waning immunity over time, and really brushing it up with a third dose. And then there's the booster, which is separate. Important to keep that conversation separate from the current booster conversation, which is a much narrower set of people who have hardcore immunocompromised conditions like transplant recipients, cancer patients, HIV patients, where we are currently vaccinating in a much more limited healthcare related office.
There's a question: are you planning to be ready for the vaccination of younger students when they become available, and what's the timing on that?
It's similar. We wait for the FDA, CDC. Those clinical trials are still ongoing. As soon as they get enough data, they're going to submit the application for authorization, emergency authorization. That hasn't happened yet. We're hearing that they're getting enough data in those trials to submit pretty soon, and then there's going to be a process where they have to review it. It's probably around October where we would, that's what I'm hearing. we don't actually know, but our planning assumption is going to be sometime in the fall, after schools open, obviously, that we would be able to, we have about 14,000 Marin County residents who are between age 0 and 11. And we're working with the same partners. We had the success in the other groups to be ready to hit the ground running as soon as that comes online for October, probably the earliest.
Great. So Ken, can you identify a couple of questions?
Sure. So we've had a number of questions that fall under the heading of this following question. With the presence of the more contagious Delta variant in just a few months until children under 12 are able to be vaccinated, why have certain guidelines and requirements been removed, such as social distancing, cohorts, sanitizing entrance and exits?
You want me to take this, Matt, or you want to lead into it? It's been removed because we've seen how successful we can be. We've been managing Delta since April in many different environments, indoor environments, outdoor environments, that weren't as consistent in the use of universal face coverings. And so universal face coverings is one of our key tools that will help us, again, optimize that learning environment, and which includes having mixing of students and includes using the classroom as teachers have trained to use their classrooms so students can have as normal as possible as a school year. We are prepared, as we've said, based on what we see, how Delta behaves in our school settings, to be more restrictive if necessary. We believe we are entering the school year with the necessary protections. Remember that this is a very layered protection. This is multiple layers that start first at the home, where hopefully families are making informed decisions that reduce the risk of their own personal exposures to COVID-19. They are optimizing vaccinations in their social circles. So they're spending more time with vaccinated groups. They're doing symptom screening for themselves and their household members and getting tested. They're not sending anyone to school and staff are not going to work sick. And so that just creates layers and layers of protection. Will the Delta sneak through those layers? Absolutely. We are prepared for that. It's done that. If you look at our dashboards from the past, we investigated, I want to say, almost 500 cases of COVID-19 that entered into the school environment. And then you saw how low the number of cases were. So we've learned, we know how to do this. We know if we partner with our school community and our community at large that we can set ourselves up for success, but we always are ready to course correct and pivot as necessary to create that safest possible environment.
Mm-hmm. Dr. Willis,
Yeah,
here's a question.
I just want to add, really quick to that we're obviously we're a learning community about this. We need to be humble. This is this novel virus. There are things that we implemented based on assumptions of transmission earlier on that are less high yield. It's really more respiratory. It's not, touch is not nearly as important as a mode of transmission. So some of those things are, as we introduce these layers, recognizing it's layered approach, we also need to pick our battles, because the more layers you add, the more challenging it is to operationalize those. We want to only really focus on those most important or high priority layers. So things like the plexiglass, screening in the schools, screening on as people walk in, just didn't pan out as that effective strategies. Disinfecting everything constantly isn't as important now as we thought it was earlier on. So it makes sense to peel things back and then enrich them with things that are more effective over time.
And Dr. Willis, why isn't there a mandate for all teachers and staff to be vaccinated?
Well, teachers and staff need to be vaccinated or tested. So that's the first important principle here, is that there's this, those who are not vaccinated, we recognize are at higher risk. The way we mitigate that risk right now is to require that they get tested on a weekly basis because they are at higher risk for infection. That remains possible. Right now, we're still under emergency use authorization, and that's been signaled as one of the barriers to really moving into a full required vaccination status, especially with regards to children. We should be aware that the FDA is probably looking at approval of these vaccines maybe within the next few weeks. And that opens new opportunities for being even more stringent in our vaccine policies. But right now, we think it's important that again, and I think MCOE and US school communities really need to be implementing that mandatory testing on a weekly basis, recognizing that small minority, I mean, the other benefit we have is about 90 to 95% of our adults in school communities in Marin County are fully vaccinated. That smaller group who aren't really do need to get tested on a weekly basis.
Mhm. So with that, Dr. Willis and Dr. Santoro, we've hit the 2:00 mark. Thank you very much. We appreciate all you've done for so many months now, right? 20 months or so related to this effort, and that you're continuing to schedule with us into the future. And to let everybody know, this will be available, and please share with your friends this information that you've received today so that they'll be able to watch this, and look forward to seeing you all on September 14th at 1:00. So thank you. Thanks, everybody.